Have you ever wondered why kids often wear metal braces while adults seem to have more invisible ones? The truth is, braces are not one size fits all. Orthodontists like me use different types of braces depending on whether the patient is still growing or if they're adults and already fully grown. Hi everyone, my name is Dr. Sonia Talley. I am an orthodontist practicing in the Washington, D.C. area, and I am board certified by the American Board of Orthodontics. First, let's talk about options for braces in kids. For children, the most common option is traditional metal braces. This is because these braces are strong, they are reliable, they are consistently applying a force to the teeth, and they require less compliance. They're great at helping to guide the teeth into the right position while the jaws are still developing. Kids may also need special devices that only work while they're growing. Things like elastics and twin block appliances, which can correct bite problems. Sometimes, but rarely, we still reach for our tried and true reverse pull headgear. This is rare, but we use it for children that have underbites, or what we call skeletal class 3 malocclusion, and when used in growing kiddos, this reverse pull headgear has the potential to avoid a jaw surgery. If baby teeth fall out too early, orthodontists sometimes use space maintainers to keep other teeth from shifting into that empty space. In early treatment, fixed appliances such as Halterman appliances or braces can be used to regain the lost space from loss of a tooth too early. Eruption guidance devices may also be used to guide how teeth come into the mouth. Choosing the right orthodontic treatment modality for your teeth is a little more complicated. Adults usually care more about comfort and appearance when it comes to their treatment. That's why they often choose Invisalign or clear ceramic braces. I have Invisalign here. This option is harder to notice. It's much more aesthetic. It has low, gentle, consistent forces, and it's really popular with my adults. We also have clear ceramic braces that are very popular in adults that need braces instead of Invisalign. These options are harder to notice and fit better with work and your social life. Clear aligners are especially popular amongst adults, and with experienced orthodontists programming the movements in the aligners, they can provide results equal to or better than braces. People often ask me about Invisalign and how it works. I always guide them to think of Invisalign like scissors and your orthodontist as a hairstylist. When you're choosing where to get your hair cut, you don't call around asking what scissors they use, do you? No, you look at the results and the skills of the hairstylist, and that's what helps you make your decision. Similarly, Invisalign is a tool in your orthodontist toolbox. We use Invisalign's technology to custom design your smile. Dr. Clark and I use our years of experience to plan each series of aligners and program the tooth movements ourselves. The computer is not in charge of your tooth movement. Your doctor is. We measure your x-rays, your bone and gum levels, your crowding, your tooth angulation, and so much more to custom design your case. There are also important biological differences between kids and adults. Since adults are done growing, their teeth move more slowly. They may face a higher risk of root damage or gum problems during treatment if these things are not planned out accordingly. They may face a higher risk of root damage or gum problems during treatment, which is why we collaborate with your dentist, your periodontist, or any other dental specialist you have to ensure that we avoid these problems while achieving straight teeth. Orthodontists like us keep this in mind when planning care and choosing the right course of treatment for you. Let's talk about the cost of orthodontic treatment. Braces generally cost less for adults than for children. Adults typically pay about 5 to 10% less for orthodontic treatment overall. For children, if they need a phase 1 and then a phase 2 of treatment, each phase is typically between $2,000 and $7,000, which is a wide range. It just is case to case. Adult braces also have a wide range. They can cost anywhere from $4,000 to $8,000, depending on the complexity. Some complex cases that involve jaw surgery, where we coordinate care with your oral surgeon, can be $10,000 or more. The difference in cost of orthodontic treatment in adults versus children come down to a few factors. One, children's jaws are still developing, so their teeth move more quickly and sometimes require shorter treatment times, whereas adults often need longer, gentler treatment since their teeth are fully set, the bone density is more mature, and prior dental work can also affect how we move the teeth. Number two is that insurance coverage also tends to favor children, with pediatric treatment being more likely to have an orthodontic benefit, while adult orthodontics often receives little or no coverage. My best advice for adults is keep a small problem small. If you see mild crowding, it will take a shorter amount of time to improve that and have a shorter cost. If you have moderate to severe crowding, you will be in treatment for a longer amount of time, and the fees are also going to be higher. In the end, both kids and adults can use metal braces, ceramic braces, or Invisalign, but the treatment goals and options can look different. Children benefit from growth-focused appliances. Their treatment leans towards aesthetic and removable choices, like aligners or ceramic braces. I hope you found this to be helpful. Remember to hit like and subscribe below, and I'll see you in the next video.